It is my pleasure to introduce Dr. Vanita Rahman. She is a board-certified internal medicine and lifestyle medicine physician. She is a certified nutritionist and a personal trainer. I love when doctors are personal trainers. It makes me feel good. She is a native of the Washington, D.C. area and earned her undergraduate and medical degree from the University of Virginia. She completed her internal medicine residency at the Washington Hospital Center and has authored several books on plant-based nutrition, including this last one, right there, Simply Plant-Based. And this has delicious, delicious recipes, so y'all buy it. So prior to joining the Barnard Medical Center, Dr. Rahman spent more than 15 years practicing internal medicine with Kaiser Permanente, where she launched a very popular and successful plant-based weight loss program. While medications and surgical procedures can be necessary and life-saving, Dr. Rahman firmly believes that nutrition and lifestyle play a crucial role in the prevention and management of most common diseases. She maintains that it's important to treat all aspects of a patient's health, including diet, exercise, sleep habits, and stress management. Outside of work, she enjoys spending time with her family and friends, traveling, exercising, and experimenting with plant-based recipes. But she also is into telehealth, and she can accept patients from California, Washington, D.C., Florida, Georgia, Illinois, Maryland, New York, Pennsylvania, Texas, Virginia, and Washington State. So folks, please help me welcome Dr. Rahman.
Thank you so much, Debbie, and thank you everyone for joining us this morning. This is a topic that is really near and dear to my heart. I think it's so important for a lot of women who are told maybe they have osteopenia or osteoporosis. So just put in the chat box if you know someone with osteopenia or osteoporosis. It's so common and there's so much confusion and it's overwhelming, frankly, to know what to do. And my goal today is to go through the science of what osteoporosis is, how nutrition can help, how exercise can help, and then to talk about medications. Not because I'm pushing for medications, but because I want you to understand what these medications are and what they can or cannot do for us. So that when you speak with your healthcare provider, you feel empowered to have that conversation. So let's get started. I'm going to share my screen. And I see there are so many of you who are sharing that either you have osteopenia, osteoporosis, or you know someone who does. And that's the thing. It's so common. Let's start with my screen here. Okay, so this is an outline of the talk. We will define osteoporosis. We'll talk about nutrition, the role of exercise, the pros and cons of medications, and give you a sort of a summary of the whole topic. Now, one thing to understand is bone density. That expression refers to how much mineral content is in our bone. And our bone density peaks at a very young age. It peaks in age 20s. And around early 40s, we gradually start to lose some bone density. And this is normal part of aging. Doesn't mean anything's wrong. That's just normal. And then it continues to decrease about 2% per year for the 10 years following menopause. So it's not a surprise. It's completely expected that as women, we will lose our bone density after menopause. So what exactly is osteoporosis? What it means is that not only do we have low bone density, but there's some disruption to the way the bone is shaped inside, if you will, the way the content is laid out. And this leads to what we think an decrease in bone strength and an increased risk for fracture. So what causes osteoporosis? Well, first, as I said, we reach our peak bone density in our early 20s. So what if we never reach our peak bone density? And that can happen for a variety of reasons, because of our nutrition or lifestyle, or maybe we had a medical condition that prevented it from happening. So already we're starting out with a tank that's not full. And then over the years, there may be less bone formation. So our bone is dynamic. Our body's constantly laying down bone content. It's constantly taking it away or breaking it down. That's what we call resorption. So we're laying down bone, we're resorbing it. It's a dynamic process. And if something causes more resorption and less bone formation, then that sets us up for osteoporosis. And what happens around the age of menopause is we produce less estrogen, and that's normal. It's physiological, that's expected. And as we produce less estrogen, our bone resorption increases. Again, that's a normal response. When we have less estrogen, we're going to break down our bone more. And this means we have less bone density, and that's why our bone density goes down by that 2% per year. Now, how do you know if you have osteoporosis or osteopenia? Well, first of all, I really want to emphasize this. There are really no symptoms unless we have a fracture. So, a lot of people are concerned like, oh, my knees ache or my hip hurts, my back hurts. Could that be osteoporosis or osteopenia? Probably not, because the only time we would experience any symptoms is if we had a fracture. And if we don't have a fracture, these typical aches and pains, they're not likely to be due to osteoporosis. So let's think of other things that could be causing it. So what are the fractures that can happen with osteoporosis? Well, the most common is a fracture of the vertebra. So vertebra that's our spine. And most often these are silent. We don't even know we've had it. And they're just discovered when we have a chest x-ray for some other reason. For example, if someone was worried about pneumonia or something else, and they may discover it. So that's what we call an incidental finding. Now, hip fracture the risk increases with age, and wrist fracture is more common in women than men and usually occurs shortly after menopause, around age 50s. Now, not all fractures in women with osteopenia or osteoporosis are due to osteopenia or osteoporosis. So fractures of the fingers, the toes, the skull, the face, these are not related to bone density. These are usually because of trauma. So let's be clear about not attributing every fracture to our bone health per se. What are the risk factors? There are other risk factors for fracture. So one is, we often think of bone density, but there's so many others. Nutrition plays a role, as we'll discuss. Smoking impairs our bone strength, excessive alcohol intake. And this is really important. Low physical activity, frailty. The biggest risk factor for a fracture is frailty. Most people who experience a hip fracture are people who are frail. They're in poor health to begin with, and they're prone to falling, and that's why they get a fracture. Falls, again, someone with poor balance, cognition, they are set up for falls. And then bone health itself. Although often we jump to bone health, but there are all these other risk factors that are going on in here too. Now, what is the role of nutrition? As I started exploring this topic, these were some of the questions that came into my mind. Like, does the type of protein matter? Is animal protein superior? Is plant protein superior? What do we know? What about calcium that we get from our food or supplements? Does that really make a difference? What about vitamin D? How important is that? And are vegetarians or vegans at higher risk for fracture because they have lower calcium and protein intake and lower BMI usually? What about dairy products? Are they really helpful? So many things to think about. And let's go through what the science shows. Now, what I'm going to do is go through a series of studies, and I don't want you to get too caught up in the technical details. I'm going to paraphrase all of these for you, but I just wanted you to be aware of where these conclusions are coming from and to show you that there is a lot of research out there. And I'm taking this research in chronological order. So one of the earliest studies, it's been hypothesized that dairy and calcium may be protected when it comes to bone health. And this study was published in 1997, looking at the association between dairy, calcium, and fracture risk. So, this has been an ongoing question. So what does the research show? And this is data from a very large study. It's called the Nurses' Health Study. And the research team has looked at over 77,000 women, followed them for 12 years. And this is the conclusion they reached. There is no association between milk consumption in teenage or middle-age years and the risk of forearm or hip fractures. And there is no association between dietary calcium intake and the risk of fractures. So let me say this again. From this very large database, what we're seeing is that how much milk we drink or how much dietary calcium we get does not seem to impact our fracture risk. Because what are we always told? Drink milk, protect your bones. And that message is coming largely from the dairy industry, but the science just doesn't support it. But let's look at more research. Now, another common question is whether animal or vegetable protein is more helpful when it comes to bone health. Now, this was a study that was published in 2001, and it's investigating that very question, which is better, animal or vegetable protein when it comes to bone health. And let's look at the data. So in this study, they looked at postmenopausal women. They measured their bone density at year 2, and then again 3.5 years later. They followed these women for 7 years, and they investigated the relationship between animal plant protein and the bone mineral density and fracture risk. Now, again, I don't want you to get lost in these numbers and technical information, but what the research team did was they divided participants into 3 groups based on how much animal to vegetable protein they were consuming. So the low group was consuming less animal protein compared to vegetable protein. The medium group was consuming more animal protein, and the high group was consuming 4 times as much animal protein compared to vegetable protein. And then they looked at their bone mineral density. And then initially when they looked at it, what they found was this graph right here, which shows that women who consumed the least animal protein had the lowest bone mineral density, and the ones that consumed the most animal protein had the highest bone density. But that they did further statistical adjustment because our bone density isn't just determined by our age, it's determined by all sorts of things. So they adjusted the data for smoking, calcium intake, protein intake, estrogen use, physical activity. And what they found was the opposite trend, that women who consumed the least animal protein had the highest bone density, and women who consumed the most animal protein had the lowest bone density. So what we're seeing is that animal protein is not protective, although that's been the traditional thinking. And then they looked at the rate at which women were losing their bone density, and they saw the same trend, that women who consumed the most animal protein were losing bone density faster than women who consumed the least animal protein. But what we were really interested in is fracture risk, because bone density is really a surrogate for our risk of fracture. That's really what we want to do, is prevent fracture. And what they found was women who consumed the most animal protein had nearly 4 times the risk of hip fracture, or 4 times the risk of fracture compared to women who consumed the least. So we're seeing this pattern that animal protein is not protective. Now, another common question that comes up is, what about soy? Can soy help our bone health? And this is a study that came out in 2003, and it's looking at the association between soy and bone density. And this was a study, again, of over 400 women. They're healthy, ages 48 to 62, and the research team divided them into 4 groups based on how much soy they consumed. And what they did find is that calcium intake did not impact the bone density at all. And again, a lot of numbers here, and it's very busy, but I'm just going to summarize it for you. What this table is showing us is that as women consumed more soy, we see increases in bone density. And as they consume less soy, we see their bone density goes down. And we see this in the femoral neck, in the trochanter and total hip. These are the areas that are most concerning when we're talking about bone density. So, and we see this in women who had gone through menopause and women who hadn't. So the data is showing that soy appears to be protective when it comes to bone density. Now, another question that's often been raised when it comes to nutrition is that maybe vegans or plant-based eaters may have a higher risk of fracture or osteoporosis because they consume less animal protein, they consume less calcium. So this was a study that was published in 2009 where they looked at vegan Buddhist nuns and they compared their bone health to a control group of women that did consume animal products. This was done in Vietnam, and let's see what the data showed. They had the same level of exercise habits. They had the same BMI, the same age in both groups. And I really want to highlight something here. What we see is that the vegan group was consuming less calcium per day compared to the non-vegan group. They were also consuming less protein than the non-vegan group, a lot less animal protein as expected. They're vegans. They both had about the same percentage body fat. However, when we look at their bone density, it's not really different in the hip area or in the spine or overall in the body. So what we're seeing is that despite the fact that the vegan group consumed less calcium and less protein, their bone density wasn't any worse off than the group that did. And this is really important. And this, again, is following that trend that how much calcium we consume doesn't really seem to impact our bone health. Same thing for animal protein. We're seeing that the higher intake of animal protein was not protective. It did not appear to increase the bone density. Now, this study was published in 2015, and it looked at the bone density of young people following a vegan, vegetarian, or non-vegetarian diet. And what we see is that, they looked at women and men aged 19 to 50, and they divided them into 3 groups. And let's see what the data show. Again, as we look at these results, we see this pattern that the vegan group is indeed consuming less calcium per day than the non-vegan group. So the vegan vegetarians are consuming less calcium. They're also consuming less protein, 69, 68 grams per day versus the non-vegetarian group. However, you can see that despite the fact that the non-vegetarian group consumes more calcium, more more protein, their bone density is not any better. Statistically, it's the same. So we're seeing this pattern that animal protein and calcium don't appear to be protective. Now, this study was published in the year 2020. This is a large study coming from the UK. It's called the EPIC Oxford study. And this study looked at the fractures amongst the study participants using the National Health Service records. The National Health Service is, of course, the UK's universal healthcare system, so they have a lot of data that can be useful. And what they looked at was the first recorded hospital admission or death from a fracture. Now, the study is really large, a lot of data, and they looked at about 55,000 completed surveys, and then another 30,000 completed surveys. So initially 55,000 people completed a survey in the early 90s to 2000. And then they were asked to complete another survey in 2010, but not everybody did. So about half the people did complete the second survey. And this study looked at diet, their socio-demographic data, their lifestyle, their medical history. So what did they find about fracture risk? So they looked at data from 17 years, and the hazard ratio tells us how much more likely something is to happen. So a hazard ratio of 2 means something is twice as likely to happen. And what they did find, that compared to meat eaters, the vegans did appear to have a greater risk of hip fracture, about hazard ratio of 2.31. That means they were 2 times as likely to have a hip fracture, 2 times as likely to have a leg fracture, 1.4 times as likely to have any fracture. However, those are relative risks. We have to really look at the absolute risk. When we look at the actual risk, what this means is that over 1,000 persons per year, there would be 2 more total fractures in the vegan group, 1.5 more fractures in the hip group, in the hip area, and half a fracture more in the leg. So when we look at the absolute risk, it's not that much greater. But still, the question really is, why was the risk greater at all? And there could be many reasons. First, remember I said only about half the people completed the follow-up survey. So we don't know if their diet or lifestyle changed. We're assuming it stayed the same, but it could have changed, which would impact the results. And also the study didn't differentiate between the types of fractures. So fragility fractures are the fractures that are caused by poor bone strength, whereas traumatic fractures are fractures that would happen to any bone because there's so much trauma, regardless of bone health. So they didn't differentiate, which is really crucial, because when it comes to bone health, it's fragility fractures that we're tracking. And they did not capture fractures that didn't require hospitalization. So many fractures are never hospitalized. It's usually hip fractures that are hospitalized. So they're not fully capturing everything. So there are lots of limitations with this study. So it's hard to know how to draw definitive conclusions from it. Let me ask you all a question. How many of you have been told that maybe you should take calcium or vitamin D supplements, that it's protective of bone health? Can we just see that in the chat? How many people have been told that would be helpful to do?
Can you repeat that question again, Dr. Rahman?
Yeah. How many of you have been told that calcium or vitamin D are helpful for bone health? That you should be taking these supplements? Yeah, so I see several of you have said yeah to both. So let's break this down. What is the story there with the supplements? Okay. So these are commonly recommended for bone health and fracture prevention, but how effective are they? What does the evidence show? And remember, I already shared data with you that in all the research we've seen so far, calcium didn't seem to impact our fracture risk. Now, this study, or a series of studies have shown that how much calcium we get from our diet or from a supplement does not seem to decrease our fracture risk. In fact, what we know is that taking calcium supplements increases bone density by about 1 to 2% after 1 year. But after that, there's no more change in our bone density. So the question is, how helpful is that to increase our bone density by 1 to 2%? It's not very helpful because it doesn't seem to change the fracture risk at all. And this study was published in the Journal of the American Medical Association. looking at the association between calcium and vitamin D supplements and bone health. And this is a study that looked at many other studies, looked at many participants in the community. They examined over 51,000 participants. And again, not to get too far into the weeds, into the details, but the bottom line is we see that that calcium or vitamin D supplements do not appear to be protective. They do not appear to decrease the risk of fractures. So the research is showing over and over again, these supplements are not protective of fracture risk or even bone density. This was another large study published in a prestigious journal called The Lancet, looking at the role of vitamin D in fracture and fall risk and bone density. And the authors go on to have a very similar conclusion, showing that, again, not to get too caught up in the technical details, but just we're seeing the same thing, that there's a small increase in the bone mineral density of the hip and femoral neck with vitamin D supplements, but there's no increase in the bone mineral density of the lumbar spine, forearm, or total body. So taking a vitamin D supplement increases the hip density by about 0.3%, which is really not clinically significant, and increases the femoral neck density by 0.76%. Again, not clinically significant. And then when they looked at the fall risk, there is no significant protection with vitamin D supplements. They do not appear to decrease the risk of falls, total, or hip fractures. Now, this is another, and the article goes on to conclude that there's little justification for the use of vitamin D supplements to maintain or improve bone health, except for people in whom we suspect rickets or osteomalacia, certain high-risk groups, and that we need to change our clinical guidelines. And yet we continue to check vitamin D levels. We continue to supplement, and research is showing over and over again it does not improve outcome. So when it comes to nutrition, I want to just summarize the take-home points. There's no association between milk consumption in teenage or middle-age years and the risk of hip or arm fractures. Women with higher soy intakes have higher bone density of the hip, and all the vegan diets are associated with lower protein and calcium intake. They are not associated with lower bone mineral density. There's no significant association between calcium intake either through the diet or supplement, same with vitamin D, and our bone density or the risk of fall or fracture. And that higher intake of animal protein is associated with greater reductions in bone density and increased fracture risk. In one study, the EPIC Oxford study, there was a higher risk of total leg and hip fractures in vegans compared to meat eaters. But as I shared, there were lots of limitations with the study, the big one being they didn't differentiate traumatic from fragility fractures. And they did not include fractures that didn't require hospitalization. So I see Hope asked, should we take vitamin D supplements for other reasons? And Hope, the truth is we don't know. One thing I want to emphasize is these supplements are not regulated by the Food and Drug Administration or the FDA. And the reason is that's important is because that means the FDA is not requiring supplement manufacturers to prove that the supplements are safe or even effective before selling them. So anyone can go out there and market a supplement. It's a billion-dollar industry, but there's no evidence that it's improving our health in any meaningful way. Now someone said, is it safe to take calcium supplements for hypoparathyroid? Karen, that's a little bit of a unique situation. I would ask you to work with your endocrinologist on that one to clarify that. Now I'm going to change directions and talk about the role of exercise, okay? So when we talk about exercise, there are two types of exercises we're going to talk about. Well, really three. Weight bearing. These are exercises that where we're bearing our body's weight, such as walking, jogging, tai chi, stair climbing, dancing, tennis. The idea is our skeleton is supporting its own body weight. And then there's muscle strengthening. That's where we're adding additional weight to our body, such as when we do weight training or yoga or Pilates or calisthenics. Now, what are the exercise recommendations? You know, the Bone Health and Osteoporosis Foundation recommends that we get weight-bearing exercise on most days for 30 minutes. So walking, hiking, running, these are all great. Swimming and biking are not considered weight-bearing because we're not supporting our body weight when we do that. So while they're good exercises, they're not necessarily the best ones for our bones. And then muscle strengthening exercises. This is when we're lifting weights or doing calisthenics like squats or lunges or push-ups. We are putting extra weight on certain muscles or bones of the body at a specific time. And it's recommended we do this 2 to 3 days per week. It really improves our bone strength. And then I also strongly recommend balance and stability exercises like yoga, tai chi, qigong. Remember, most falls happen because of poor balance and stability, not because of poor bone density. If we can prevent the falls, we can prevent fracture. So, and these are great for building our balance and stability, and it's recommended we do these on. So what can we do for fall prevention? Now, falls are the leading cause of both fatal and non-fatal injuries. Falls are the leading cause of over 90% of hip fractures. And in one study, a home-based exercise program decreased the risk of fall by 74%. Imagine that. Just good old exercise at home decreased the risk of fall by 74%. You know, if there was a medication that could do that, it would be a blockbuster. But this is how important exercise is for our bone health. How about the effect of exercise on fracture reduction in older adults? Let's look at what the data showed. According to this study, regular exercise decreased the risk of overall fracture by 51% and decreased the risk of vertebral fractures by 44%. So huge decreases in fracture risk, better than what we would get with certain medications. Now, one of the most common and easiest exercises for people to do is good old walking, right? We can do that anywhere. We don't need any training. We don't need any special equipment. We can do it wherever we are. How effective is walking in terms of decreasing our risk of fall? Well, let's look at the data. This is again looking at the Nurses' Health Study, the study that we looked at before for calcium intake. So what we see is that walking more than, walking an hour a week decreased the risk of hip fracture by 21%. Walking 2 to 3 hours per week decreased the risk of hip fracture by 22%. And walking 4 or more hours per week decreased the risk of hip fracture by nearly 40%. So imagine that, just simple walking. And the pace of walking was also important. So walking at an average speed reduced the risk by about 50%, but walking briskly or very briskly, that decreased the risk by 65% of hip fracture. So this is how powerful exercise can be. And the authors go on to conclude that if all participants had exercised at 24 minutes or higher per week, 42% of hip fractures could have been prevented. So what is a MET? So 3 MET hours are equivalent to walking for 1 hour per week at an average pace. So if people had walked about 8 hours per week at an average pace, their risk that we could have prevented 42% of hip fractures. So imagine that. That's just really a tremendous benefit. So what are the take-home points about exercise? Falls are the leading cause of hip fractures, and regular exercise can decrease falls by 74%. When we're talking about fall prevention, we need to not only think about bone health, but we need to address frailty, balance problems, fall hazards, and visual impairments. Think rugs on the floor, think cords, tripping hazards, and not being able to see properly leads to more falls. And then in postmenopausal women, walking 4 or more hours per week is associated with 41% reduction in the incidence of hip fracture, and brisk walking is associated with 65% reduction in hip fracture. These are some helpful websites on fall prevention tips and also exercises that you can do. There's some videos. And this is what you can, these are some other websites that you can go to. They talk about different types of balance exercises and some more to strengthen our bones and improve our balance and stability, decrease the risk of fall. So these are simple things. They don't require fancy equipment. We can do them in our home. Now, let me spend a few minutes talking to you about medications. I think it's important for all of us to know what these medications can or can't do. Now, someone asks, Vicky asked, what about stair climbing? Yeah, stair climbing is a great weight-bearing exercise because your skeleton has to support its own weight. Just be sure to do it safely on steps that are solid, not uneven. There's a railing you can use if needed. So then someone asked, Karen asked, is it safe to take oh, okay. Yeah, we answered that question. All right, let's talk about medications. So bisphosphonates are a group of medications that are the most commonly prescribed medications for fracture prevention in women with osteoporosis and even for some women with osteopenia. So I'm going to just give you sort of the bullet points of what you need to know about these medications. There are many different ones, Fosamax, pamidronate, risidronate, alendronate, just a long list of medications. What they do is they decrease the rate of bone breakdown, if you will. But as they're doing that, they also get incorporated into our bone as it's forming. And then once they enter the bone, they can live there for 3 to 5 years. We don't know for how long. Now, do they prevent fractures? Yeah, they do. Research shows that they prevent about 33 to 70% of vertebral fractures, and they can prevent about 27 to 50% of hip fractures. However, we should also know what the limitations are and the side effects. They can cause severe esophagitis. They can cause atypical fractures. So they're meant to prevent fractures, but ironically, they can cause atypical fractures of the femur or a thigh bone. They can cause osteonecrosis of the jaw, which means the jaw sort of dissolves. They can also lead to severe bone, joint, and muscle pain. Now, the atypical femoral fractures and the osteonecrosis of jaw are the most dreaded side effects. They are very uncommon, but they can happen. But the biggest unknown with bisphosphonates is how long do we continue them? What happens when we stop them? How long would the bone density stay strong? How long till the risk goes back to where it was? We don't know. And this is one of the big unknowns with these medications. Then there are newer drugs out there, like you may know them by their brand names, like Prolia. I don't want to get too much into the weeds about this, but I wanted to impress this upon you for most of these medications. So this is a medication that also decreases the bone breakdown. It can be used for up to 5 to 10 years. And the numbers look good, right? They prevent fractures. However, look at what I've highlighted there for you. Once we stop the medications, there is rapid weight loss, which can paradoxically result in multiple fractures. So sure, while we're taking them, they're helpful, but as soon as we stop them, boom, our risk goes up. And these can also cause those atypical fractures and jaw problems. So nothing to take lightly. Then there are other medications like parathyroid hormone analogs. These also can reduce the risk of vertebral fractures and non-vertebral fractures. However, their usage is limited to 24 months. There is an increased risk of bone cancer with these medications. And once again, as soon as we stop them, there is rapid bone loss. So what they're doing is they're basically delaying the inevitable, most of these medications. There's another group of medications called sclerostin inhibitors. They increase our bone formation. Yeah, and the numbers look impressive. At 12 months, they decrease the risk of fractures. However, same thing. As soon as we stop the medication, there's rapid bone loss. And this medication is also associated with some scary side effects, increases the risk of heart attack, stroke, cardiovascular death, atypical fractures, jaw problems, and their usage is limited to 12 months, which always makes me wonder, what are we supposed to do after 12 months? Because we know our bone density is going to plummet again. So what did we really gain by taking them? Hormone replacement therapy was once commonly prescribed to preserve bone health. And it's true, hormone replacement therapy increases bone formation. It will maintain our bone density. And at 5 years, there is a reduction in vertebral and hip fracture for about 34%. It also improves hot flashes, vaginal symptoms. However, once again, we see the same pattern. As soon as we stop it, we will experience rapid bone loss. And then hormone replacement therapy is associated with higher risk of breast cancer. It can be associated with endometrial cancer if it's not dosed correctly with progesterone. And research has shown that in some women, it's associated with a higher risk of heart attack, stroke, or blood clots. Now, going back to those bisphosphonates like alendronate, fosamax, you may know them by, they're the first line of treatment for most people. However, it is unclear how long we should continue them. It's also unclear what happens to our bone density and fracture risk after we stop them. So these are really the take-home points about medications. There are lots of expensive, fancy medications out there. They do reduce the risk of fracture, but they're associated with rapid bone loss after we stop them. And bisphosphonates don't lead to rapid bone loss after we stop them, but that's because they stay in our bone for a long time. But it's not clear for how long. And then usually the recommendations are to stop bisphosphonates after 3 to 5 years because there is that risk of atypical fractures and jaw problems. And one of the things we don't know is what happens after we stop them. On the other hand, as I shared with you, exercise can be highly effective in decreasing the risk of falls and fractures. So to the point where it's comparable to some of these medications. Well, let me stop right there and I'd be happy to take your questions.
Well, there are plenty of questions. You got us thinking for sure. I'll ask the first one from the chat box. How long has it been known that alcohol consumption affects bone density? Is that new information, or when did they figure that out if it's not?
You know, that's a good question. I think we've known that for a while. You know, you have to remember a lot of special interest groups are playing a role in everything, and especially when it comes to alcohol. There's a lot of research getting funded by the alcohol industry showing that alcohol is benign. It may even improve health. It's part of this Mediterranean diet. But I go by what the American Cancer Society says. They say avoid all alcohol. Not only is it associated with poor bone health, it's associated with poor cardiovascular health and a higher risk of many cancers.
Okay, that was Paula's question. So let's see. Why don't you, Debbie, tell us what the next question was?
There was mention about soy being beneficial. How much daily soy do you recommend?
Yeah, you know, I don't know if we know enough to know how much to recommend. What I recommend is eat the amount that you enjoy eating. Don't force it. Soy comes in many forms, edamame or soy in tofu or soy milk or actual soybeans. Enjoy it in whatever form appeals to you. However, if you are dealing with hot flashes, a research study that our team completed showed that half a cup of cooked soybeans, which is not the same as edamame, the actual soybeans, half a cup of cooked soybeans can drastically decrease hot flashes. But otherwise, I'd say go with what you enjoy rather than forcing a specific amount every day.
Okay, wait, so edamame and soybeans, not the same.
No, no. Edamame are usually sold frozen. They may come in a pod or they may be shelled. Those are immature soybeans. The hard soybeans kind of look like chickpeas. They're hard like chickpeas. They take about an hour in the pressure cooker to cook thoroughly. They are mature soybeans. They have a higher content of soy-based estrogens than do the edamame. And that's why they have been that's why we investigated those and they were shown to be helpful in decreasing hot flashes.
Okay, I think Linda's next.
Okay, there was a question about your thoughts on Dr. Lauren Fishman's yoga for reversing osteoporosis.
Yeah, you know, I'm not familiar with their specific program, but in general, yoga is really beneficial. Remember when we're talking about osteoporosis, it's not really the bone density that matters. It's fracture prevention. We want to prevent fracture. And yoga is really helpful in that. It improves our agility, improves our balance. You know, if you can stand in one foot and do a tree pose, you're less likely to fall next time when you're on one foot. On the other hand, someone who can't do it may be more likely to fall. So I'm not saying jump into anything aggressive, go gradually, but the more you practice, the more you'll improve your balance and stability.
What about somebody's asking about doing a HIIT routine on a rebounder, or if rebounding in general does anything to help?
I think by rebounder, you mean like those trampolines that you're
Little mini
jumping on?
trampolines, yeah.
I'm always very nervous about those because it's a relatively small surface, or even if you have a big one, I worry about more falls with that because you're landing on it, you're jumping on it. I would say instead doing HIIT exercises on solid ground will be safer. Just the trampolines in any size make me uncomfortable, and there are a fair number of injuries on them. It's easy to get your foot caught in that the area between the framing and the sheet. It's easy to fall off of those, so twist your ankle. So our goal is to prevent falls. So doing an activity that's more fall prone is probably not a good idea.
Hope was wondering about should vitamin D be taken for any other reason besides bone density, since it doesn't seem to be important there. And Sandy and Clyde had been told about taking bone density, but wondered about something they heard on television about vitamin D is bad for the heart. So are there some things about that we should look for more information on?
You know, I think we don't know the answer. Again, it comes back to this whole issue with supplements really being pushed by the supplement manufacturers. In the US, an act was passed, and I'm forgetting which year, which deregulated the supplements industry. Now you can all imagine who was behind that, the supplement industry. In Europe, that's not the case. Supplements are regulated, and they should be here too. And the thing is, we just don't know. A lot of these therapeutic uses they're touted for, we don't know if vitamin D is effective. I think at this point, I tend to go with that review and the author's conclusion that I shared, that there's really no need to routinely screen vitamin D levels or prescribe vitamin D supplements. And we're seeing that in the clinic. It's just not shown to be helpful at all.
You talked about weight-bearing exercises being very important for our bones. Is there too much weight-bearing? You said 8 hours is optimal for, I think it was a 42% reduction in fractures. Is there a point where there's too much weight-bearing exercise?
Yeah, so weight bearing in that study that you're referring to, Debbie, that was 8 hours per week. So if there's 7 days in a week, that's about an hour of walking a week, maybe 70 minutes of walking per week, roughly 70 minutes of walking per day. That's all together. I think there can be a point when there's too much weight-bearing exercise if it's leading to fatigue and exhaustion or injury. Imagine someone who is walking and walking all the time to the point where they're exhausted, and now they're likely to fall and get injured, which can happen in people with cognitive decline or other behavioral health issues. Or imagine someone who's running excessively to the point where they're developing ankle pains or ankle sprains or knee pains. So listen to our bodies. If it's starting to cause injury and pain, then that's too much. But certainly for most people, try to aim for about an hour of weight bearing. And that's over the course of a day, standing in your house, vacuuming, that counts as weight bearing. Going up and down the steps, that counts as weight bearing. So it's all together. It doesn't have to be just that period you designate as exercise.
Dr. Rahman, along those lines, elliptical machines and running, are those good, bad, ugly, better?
Yeah. No, running is great. Running is also weight-bearing exercise. Just again, always be careful about the trail you're running on, the path you're running on, even surface, good solid shoes, good footing, just to avoid falls. And then as far as ellipticals, that's also weight-bearing exercise. It's someone asked about stair climbing. It's like stair climbing, but you're doing it on a machine. So your risk of injury is actually lower, but your body's supporting its own body weight at the same time. So that's a great exercise too.
And Ruth is asking a question that I think you'll want to answer. Most studies that you talked about were about calcium supplements, but she's assuming it's still beneficial to eat foods high in calcium, such as dark green leafy vegetables. Is that correct?
Absolutely. We're not saying we don't need any calcium. We're saying we need it. But the amount we need is probably a lot less than we've been told. And most people now agree that we should get the calcium we need from our food. So dark leafy green vegetables, beans, fortified soy milk or almond milk, those are all great sources of calcium from our food.
Are there foods that interfere with the absorption of calcium?
There can be interactions with calcium. One of the common ones is with thyroid medication. So hopefully no one is taking calcium supplements unless, I know someone mentioned parathyroid condition. And with parathyroid disorder, sometimes you may need to take calcium supplements, but your endocrinologist will talk to you about that. But if for some reason you are taking calcium supplements, the interaction you can see is with your thyroid medication. So if you take thyroid medication, avoid all calcium supplements within 4 hours of taking your thyroid medication, because calcium interferes with the absorption of thyroid medication.
Okay, on the same light, What about what would enhance the absorption of calcium in your, we're talking about food now, you know, whole food, plant-based. What would improve it, the absorption?
Yeah, I don't know if we know enough to know. The amount of calcium we absorb is very dynamic. It's based on how much we need. It's based on how much vitamin D our skin is producing. So it's all very dynamic. I say for most people, focusing on eating a balanced, healthy diet, rich in plant foods is the best way to go. And we don't necessarily need to worry about these micronutrients as much. You know, much is made of them, but the research is showing that really focusing on them is not the issue. For most people, it's just eating a well-balanced diet that's the most important issue.
Dr. Rahman, there was a question about calcium supplement-based milks, are different from a calcium pill. Like, you know, when, you know, calcium is added to milks, is that
Right.
along the lines as a supplement?
Yeah, you know, that's a really good question. So a typical supplement is got about 500 to 1,000 milligrams of calcium in a small pill. A cup of, now soy milk doesn't usually naturally have calcium in it. It's usually calcium is added to it. So we call that fortification. Same with other plant-based milks. So why is that better? Well, the reason is if you look at a cup of soy milk, it may have about 350, maybe 400 milligrams of calcium in an 8-ounce cup, compared to at least 500 in a tiny calcium supplement. So it's just the concentration that makes a difference. You know, when you drink that 8 ounces of soy milk, even if you're drinking 8 ounces, you're not having it in one sip. It's being taken over a period of time, even if it's 10, 15 minutes. Whereas that calcium supplement is just boom, going immediately all at once. So we think it has to do with that as well. And then maybe there are other nutrients in the food that delay the absorption, so it's absorbed more evenly when it comes from food rather than a supplement.
Cannon had another question that was good. It was about HRTs. Can you talk to us about that? Some have been taking it for postmenopausal women. Recently, it's been promoted as valid if started during perimenopause. What's your view on that?
My view on HRT in general.
Can you do that?
I've been listening to a couple of podcasts by medical doctors who were talking about the validity of HRT being really good if you started during perimenopause as opposed to postmenopause for all the good results for brain health, bone health, all of the above. If you start during perimenopause, it works. But if at my age, I'm postmenopause, it wouldn't work for me, is what they were saying. And I just wanted to hear what Dr. Vanita has to say on that.
Yeah.
Thank you.
You know, I think this is a really good question. There's so much confusion about HRT. HRT stands for hormone replacement therapy. It's a combination of estrogen and progesterone that women are prescribed after menopause. When I was in medical school and in training, it was common practice to think as soon as a woman's entering perimenopause, let's just start HRT. It's full of benefit. And then we got data showing that no, that's not really true. It actually increases the risk of certain cardiovascular diseases in some women, increases the risk of breast cancer in women. So we kind of put a pause on the whole thing. If you really take a step back and look at the data, it is true that HRT improves bone density, decreases the risk of fracture. But as I said, once we stop it, it all comes back. And it does increase the risk of breast cancer. The longer we are exposed to estrogen, either the estrogen that we produce or that we take in therapy, the higher our risk of breast cancer. This is why starting a period later in life, ending a period earlier in life is protective. This is why even pregnancy and breastfeeding is protected, because during those periods, our body's producing less hormone. And this is why HRT increases the risk. We're increasing our exposure. And research has shown is that the risk of cardiovascular disease is greater in certain women who are prescribed HRT. Now, I think there are some women who take it, and the ones that benefit from it do benefit, but we have to balance that benefit with the risk. They do improve hot flashes, they do improve bone density, they do improve vaginal health. That's a given, but once we stop it, we're going to go right back into those states. So it's really delaying the inevitable. And then if you just take a step back and think, gosh, menopause is a normal part of life. We're supposed to go through this. Our hormones are supposed to stop. So at some point, we can't keep taking this. And what is that point? So I am not a fan of it. I don't recommend it. But I think in limited cases, it can be taken, but knowing all the risks that are involved with taking it.
Women who are already small boned, like my doctor has told me, I'm at the greatest risk because I'm a small boned, low weight white woman, and that I'm at the greatest risk for osteoporosis already. So is there anything specific that people, and somebody else asked that in the chat too, is there anything specific for people like us?
Yeah, I'm so glad you brought that up, Vicky. Women have been told that forever, right? You're small boned, I'm petite too, so I get told that too. Look, that is true. Our bone density may be less, but there's data questioning whether bone density is really the best predictor of fracture risk. It doesn't really matter what our bone density is. What we really care about is our fracture risk. We don't want a hip fracture. But if you look at the data, it's clear, it's really frailty that's the biggest predictor of fracture risk. And the reason that people with hip fractures do poorly is not because they fractured their wrist, it's because they were frail to begin with. Their health was frail. They were dealing with all sorts of issues, the least of which was their hip fracture. And so we tend to lump it all together. So I'm not sure if that old way of saying, if you're petite, if you have a low BMI, your risk of osteoporosis may be higher. Sure, but I said, but what about my risk of fracture? That's what I really care about. And we can protect ourselves with the things I just shared with you: regular physical activity, improving our balance, improving our stability. That is really powerful. And I think that's what we need to focus on.
If somebody has a high calcium on their lab work and they say that they're on Prolia and they are taking daily intakes of calcium and D3 for bone loss, what are your thoughts? And that's going to be our last question.
So they're taking Prolia with some medications because they're increasing bone formation. They're told to take calcium supplements so there's enough to build a bone. I would really talk to your doctor about that and see if your levels are where they need to be. We don't want too much calcium. That can cause problems, but I wouldn't make that decision alone. I would talk to your healthcare provider about that.
Well, Dr. Rahman, I believe you received our thank you present. And if you have it there, if you want to just share with everybody, and that is.
Yes. Also, yes. Thank you for this great lavender pillow. I love it. And it's so perfect because of what we're talking about. So I can heat it or put it in the microwave or put it in the freezer. So if you get those aches after exercising, I'm looking forward to using it. Thank you so much, Debbie. It's lovely.
Well, we appreciate you being here, sharing your time and your knowledge. You can see by all of the questions that we received that this is truly a hot topic. And this is going to be recorded. It's going to be on Chat and Chew More Plants on YouTube. And so everybody can watch this over and over. You can share it with your friends. But Dr. Rahman, we truly appreciate you being here. And we thank you so much for making this possible.
Oh, thank you, Debbie. Thank you for organizing this program, and thank you all for joining and sharing your Monday morning with us. So great to see you all.
And while she leads us, I want to share with you just our final announcements, because as we said in the emails that have gone out, that this is the last live Zoom for this 2023-24 year. And just as Dr. Rahman's video will be on YouTube, all these other speakers are on YouTube as well. And so you want to take a look at those. I mean, we've had fantastic speakers this year. Dr. Jill Jennings started us off with a real positive attitude that even breast cancer can be a blessing, and how she's gone about it. I mean, that goes all the way through to Dr. Greger's public appearance for us here in Lakeland. And then we heard in February from Dr. Tehar, and Debbie did one on coloring foods for health. So lots there for you. But we did want you to know that things are happening during the summer. And I'm going to briefly go over with some of these, and Debbie will help me. So Debbie, why don't you start with the first one? Building a plant-based healthy community in Polk County and online. What is all that about?
Well, this is exciting for me because the Physicians Committee is having these healthy communities, and they're supporting this with educational materials. They're encouraging us to have in-person programs where we really can support our healthy community, or support building a healthy community. And then the Esselstyn Foundation has put out information about wanting to build these healthy communities, and they're called Trailblazers. So I have actually spoken to the Esselstyn Foundation. They said that I could use the Trailblazers as a jumpstart for our healthy community here in Polk County. But then I have built through Food for Life a very wide healthy community online. So together we want it online, we want it in person. So the question is, are you interested in learning more on a regular basis, maybe having books, book reviews, sharing recipes, having more support? So if you're interested, please take down my email information or put it in the chat box so that I can contact you. And yes, we are going to be building healthy communities because we know that this plant-based education is so vital for our personal health. And once you know about it, you cannot put your head in the sand. You have to share this knowledge. And if we can start pulling in people who need this information, then hopefully we can influence more and more people. So be an influencer, join us.
We suggest that you might subscribe to the podcast. We've done 1 year now of podcasts, so there's, I think, 13 of them now up there. And then also Dr. Rahman's video will be up this week, so take a look at it. It'll be on our YouTube channel. And if you subscribe to our YouTube channel, you'll get through the summer notifications, if you check it, of things like this. This is coming up this week. This is a short chew chat, or a short video with Dr. Callie Ova that's going to tell us about what about weight loss and drugs and their injections. Are they good for us? Are they an answer? That will be on the YouTube. And if you still have not joined our email list, this is the one that you'll want to join to get the monthly newsletter.